Hi, in today's video I will tell you how to treat anxiety and depression as a diabetic. Welcome to Diabetes Free, the place where you get advice, motivation and inspiration for a happy and healthy life, of course, diabetes free. If you stay until the end of this video, I will show my secret method to treat diabetes and your anxiety at the same time. If you want to see more videos about how to reverse type 2 diabetes, please subscribe to the channel, like the video and tick the notification bell. A diabetes diagnosis can be a life-altering event. A type 2 diabetes diagnosis can mean changes to your lifestyle that you may not be ready for and can also be hard on relationships with friends or family. As you establish a new routine, it is important to establish good habits in managing your mental health. Proper diabetes management requires awareness of your symptoms. Just as you take insulin to ensure your blood glucose levels are where they should be, it's important to take measures to prevent mental health crises, by being aware of how you are feeling mentally and emotionally. Just like taking care of your body, taking care of your mind is equally as important to living a healthy life. When left untreated, mental health conditions like depression and anxiety can make diabetes worse. Likewise, existing diabetes can make mental health conditions worse. A diabetes diagnosis can feel like not just a threat to health, it can also seem like a threat to a person's way of life, because managing diabetes means making changes to your day-to-day routine. Your doctor might instruct you to change your diet by eating certain kinds of foods, avoiding sugary beverages, or restricting alcohol intake, which can be difficult for anyone regardless of a diabetes diagnosis. Added responsibilities like tracking blood glucose and insulin can be hard to remember at first, doctor's appointments can cause time away from work, and the costs of appropriate care may be burdensome. These changes can be emotionally draining, and you might start to notice that you are feeling a bit off, or have very little energy left to carry out important tasks to manage your condition. The fear of blood sugar fluctuations can be very stressful. Changes in blood sugar can cause rapid changes in mood and other mental symptoms such as fatigue, trouble thinking clearly, and anxiety. Having diabetes can cause a condition called diabetes distress, which shares some traits of stress, depression and anxiety. Unlike depression, diabetes distress can be linked back to causal factors related to diabetes. For example, fear of hypoglycemia or a very low level of blood sugar may cause significant worry. Diabetes distress can also be affected by external factors like family and societal support and healthcare services. It is estimated that 33 to 50% of people with diabetes will experience diabetes distress at some point. While diabetes distress cannot typically be treated with medication, experts say that improving diabetes management to reduce stress, talk therapy and support groups can be helpful. One of the biggest challenges to treatment of mental health conditions for people with diabetes is low rates of detection. Up to 45% of mental health conditions and cases of severe psychological distress go undetected among patients being treated for diabetes. Diabetes treatment teams need to be aware of the mind-body connection and ensure whole-person care. One way of doing this is by conducting regular screenings for mental health conditions during office visits. It is estimated that only around 1/3 of people with diabetes and mental health conditions receive a diagnosis and proper treatment. This may be because the signs and symptoms that people experience when their blood sugar is too high or too low can be confused for depression or anxiety. People with diabetes also may face stigma in talking about their feelings of depression, and tend not to talk about them at appointments. Mental health conditions, just like diabetes, are treatable and reversible. Having both at the same time doesn't make either one less treatable, they just require different treatments. Ask your diabetes care team about a referral to a mental health care provider like a psychiatrist, psychologist or therapist. Together, your doctors can help you find a treatment plan that works for your mind and body to be as healthy as possible. Therapy is an extremely helpful treatment option, and people with and without mental health conditions can benefit from it. Talk therapy is not only for discussing your problems, it is also for finding solutions. Professionals can help you work through the many things that may be causing you stress, understand your mental health condition, and identify triggers that may make things worse and learn coping skills. A diabetes diagnosis can cause prolonged stress, which may possibly cause a rise in blood sugar. Stress can also make following your diabetes maintenance routine more difficult. Experts suggest looking for patterns. Be aware of your stress level each time you log your blood sugar and see if a pattern emerges. If you notice a pattern, you can learn to spot your stress warning signs and take action to prevent stress and keep your blood sugar low. This may mean working with a professional to learn relaxation and coping techniques. Just as diabetes therapy must be reviewed and adjusted frequently in order to find a long-term solution to care, finding the right mental health treatment can take time and be a process of trial and error. Like with many other chronic conditions, the sooner you get help, the better. I think a healthy lifestyle can help reduce your stress levels and anxiety because you will see an improvement in every few days with your disease. You will see the light at the end of the tunnel and you will feel much better. I want to help you on this journey with my free guide with 7 tips on how to reverse diabetes. Click on the link in the description and download my free guide now. If you want to watch more videos on how to reverse type 2 diabetes, make sure to subscribe to my channel. See you next time.